secure attachment status affords us so many possibilities in our life. It increases our IQ, our performance on IQ tests when we have a secure attachment status. So think about how pervasive this is, that this doesn't just help us in our relationships. We live longer when we have a secure attachment status. What do you think about that, you know? Look at the ACEs study, you know? So, are you guys familiar with the ACEs study? So, you know, the Adverse Child Experiences study talks about a lot of those things. So, now maybe this, what you guys are more interested in is, when do we see some concerning behaviors? Some of this is going to be at your core, it's going to be intuitive, you're like, duh, that would be a concern. Like back to the mom that I met, you know, saying this isn't my baby. But when we see parents that have a high level of anxiety, either, you know, pre the birth of the baby, you know, postpartum, we have to put that in perspective, because as we've learned from people like Reva Rubin, some of that is expected. There is some bunkering down and focusing on myself for a little while. We're talking a couple of days. I just had this baby, I gotta kind of focus, I got the baby under control, but I'm not quite ready to shift to being fully in the mother role. I kind of bunker down. Would you say, nurses, that that's what you might see a little bit, that there is a little bit of focus on me healing and kind of getting in the role? And you guys have seen that much more often. I'm not usually with parents when they've just had a baby, but that's what I've read in the research is what we might expect. So, but I think that we often talk about postpartum depression. And as I've, you know, read over the years about perinatal mood disorders, I'm thinking that we forget a lot about the fact that it's not always depression that we see. It might sometimes look more like anxiety that we see during the pregnancy period, and maybe the person isn't just talking about I'm depressed, but I'm a nervous wreck, or I've got this generalized feeling of worry and you know, something's going to happen. So I think that we do a good job of screening for, you know, depression, but we want to keep in mind that there are some other things that we now know that can happen as a result of being pregnant and having a baby. So flat affect and withdrawal is something that we would want to be concerned about. Of course, we don't know this person very well. I'm trying to speak to the fact that when they're right in the hospital, what you might see. And I think that some of that would be put in the context of who this person is. But when you see a lack of enjoyment, a feeling that kind of hits you at your core that something's not right, I would pay attention to that. Because most of us that do mental status exams, a lot of what we experience internally is our guide to kind of wondering about what's going on with that person. So when we have this feeling of, wow, this feels very sad to observe this, and then we pay more attention, we often will say, yeah, there's something there that doesn't feel right. Failure to speak of the infant by name, the baby, you know, and I know sometimes that's typical, but you sometimes might see a pattern which might reflect a distancing of this person, this baby, you know, where, and again, we don't want to over-analyze any of these things, but, you know, it's something to pay attention to. Negative interpretations of the infant's behavior. A lot of us are going to be in circumstances where we're going to follow the parent in programs like yours after they've had a baby. And you might not catch this in the hospital, of course, but we're going to be looking for this over time. If they're saying things that I thought that people would not say, like that baby's biting me on purpose because he hates me already when they're nursing, or that baby's just like his dad because he keeps looking at me with this evil eye. And I thought people really wouldn't say that when I read about that when I was younger, and I'm like, they do say that, and they do really believe that, and that's important sometimes for us to put that in perspective. They're not stupid or any other negative thing we might say. This has been their experience, and it's now the baby. This baby is now the people that have hurt me in my life. That's a worry. So when we have negative comments, just flat out negative comments regarding not only the baby but myself and my capacity, you know, deprecating remarks, that's of concern. And unrealistic expectations of the infant. I had a mom who said to me when I saw her at, you know, baby was 5 or 6 months, that she was really upset that he wasn't walking yet. Now that's, you might think, wow, does she really believe that? Well, when there are unrealistic expectations in terms of development, but also in terms of what they do for you in relationship, that's where I get more concerned. When this baby is supposed to meet my needs for attachment, maybe I don't say that because it's not in my conscious awareness, but now I got somebody to love me, and you know what? The only thing they gave me was a poopy diaper. What's this all about? I was expecting that I had all this attention, much less a mom who says things like, I'm really getting sick and tired, either verbally or through her actions, of everybody focusing on the baby. I thought for once in my life somebody was going to focus on me. Those are kind of things that don't necessarily get verbalized in a direct way, and sometimes they do. But I think we need to pay close attention to that. A lack of positive affect when interacting with the baby. Have you seen people where you feel like this is not just stress, or not that it's even difficult, I just am almost in misery, I'm not enjoying this, I don't want to be here, and it feels really unpleasant to even observe this level of almost hostility. We will sometimes see hostility. And I think that something that to point out is that there's a reactive attachment disorder as a diagnosis, which is really overdone in the DSM, and everyone that in the field agrees that it's very hard to identify somebody by that criteria. Most infants have like a range of symptoms, but one of the most disorganizing patterns of attachment is called disorganized attachment. And when you don't have a frame of reference from which to organize yourself, so you don't have a theory of mind about who your parent is, you're just perplexed. You don't know if they're going to come at you in a nice way. You don't know if they're going to come at you in a unpredictable, hurtful way. And so you just kind of grasp at what you got. And so you're left in this kind of almost dissociative state some of the times. You experience that the person that you're supposed to care for is hurting you. They often develop that attachment pattern when they've experienced things that you might see, which is teasing behavior, kind of like you want the bottle, and you're like, oh my God, look at that horrible face. I've watched reams and reams of videos and trainings that I've had, and in my infant mental health training, where we would stop it and we'd see a face that was like horrifying. And not to mention the faces of the babies, that their eyes were like this. We would look at these things to kind of learn how to code things. And when they would freeze it, it would be like, oh my God. I mean, the mom looked literally like at times like, and then this inappropriate laughter when I've done that. So why might somebody do something like that? And I think that that's a person who has had a very damaged past, a very hurtful past that they have no recollection. It's not in their conscious memory, and it's getting reactivated through this relationship. This baby isn't this baby, it's my persecutors in the past. And so that's a very disturbing thing. If you ever see that, stop in your tracks and make a referral to Anne, because that's not uncommon. They often will do things as babies get older, like they might run to them with this look like, oh, come on, you just came home from preschool, I'm so happy to see you. And then they turn and flip on them and do this real abusive interaction. And the baby's like, whoa. And I thought, you guys are full of baloney if you think that a baby's going to freeze in their tracks and just dissociate and stare at the wall for 15 minutes. I've seen it. They'll approach their mom with this, okay, what she got? And it starts to, something must get triggered, I need to just check out.